Under a new plan, patients will be urged to use high street pharmacies for some prescription medication and routine tests to ease the pressure on our very busy, overstretched doctors.
Yes, when we announced these plans by the government yesterday, there was a huge response from you. Because when it comes to our health, a number of people questioning, can we put our faith in pharmacies? Or do we prefer to trust a family doctor? Joining us now, private GP, Dr Lawrence Gurlis, who says pharmacists would struggle to diagnose effectively. But in the pharmacist's corner, we have Thorin Govind, who claims some are already prescribing medication and they're perfectly qualified to do so. Very good morning to you both. So, Thorin Govind, the pharmacists, they can help, and they can help ease the pressure on GPs, and they can also help you with your ailments.
Absolutely, and we know that in Scotland, for example, this scheme is already working really, really well. This is not a new concept, and a recent YouGov poll, 75% agreed that pharmacy was the place for these common conditions, UTIs, sore throat. So really, why is England not on par with Scotland and the other nations when it comes to healthcare? They're even getting free prescriptions. It's not the same here in England.
Dr Lawrence Gurlis, why do you disagree?
I'm not sure we should be taking lessons from Scotland on how to run the NHS. I have serious concerns about treating things like urinary tract infections.
Right.
I've seen, at least within the last few weeks, 3 problems. Some people who thought they had urinary tract infections, one had kidney stones, one had kidney cancer, and one had an STD. There's an epidemic of chlamydia among young people. Different antibiotics are needed. They all need to be investigated. I don't believe pharmacists are up to... I actually think pharmacists are too busy. The pharmacists I speak to every day are usually locum pharmacists who haven't got time even to answer the phone, and I don't think they've got the time or facilities or the privacy to do this effectively.
Would the symptoms for all those 3 conditions have been the same?
Could be exactly the same. People come in saying, I think I've got a urinary tract infection. Until you investigate, it's very hard to distinguish.
We're masters trained and above healthcare professionals. We have an ethical duty to our patients. When you come into the pharmacy, and we've seen an increasing number of people into the pharmacy, we are asking you those questions. We are looking for what we call red flag symptoms, which might mean you need to be seen elsewhere in the health system. But ultimately, this is about access, isn't it? And we, as community pharmacists, are providing to patients free at the point of access care. And for them to be able to come into us and speak to a healthcare professional, a highly trained healthcare professional, within a matter of minutes, not having to make an appointment, is really powerful. So we must place our faith in pharmacists as part of the wider healthcare system, because we have a really important part to play.
There is a difference, though, isn't there? Because GPs are public servants in the National Health Service, and pharmacists, who do a brilliant job, are often private businesses, and they have to think about how they manage their own risk. And if somebody comes in and says, I've got a sore throat, that's easy. But if it's something more complicated, isn't the pressure on the pharmacist to think, well, actually, the easier thing for me to do is either give them the drug or send them to A&E, whereas the NHS doctor it's easier for them to say, actually, I don't want to give you the antibiotics. Isn't this likely to lead to more prescription?
I disagree, because we are like general practice. We're working under an NHS contract. So I really resent this insinuation of private business, in a sense, because we are there.
It's a good thing to be a private business. I'm not saying that's a bad thing. I'm just saying that, what is the pressure on the pharmacist?
Well, it doesn't impact my decision-making. I have an ethical duty towards my patients.
Can I just say...
I have to make sure that they are given the right medication at the right time for them. I am also regulated, so if I don't provide that drug correctly, there are people who are going to check up on me, just like they do with GPs.
I just want to say you're right to raise the idea that we're going to be using more antibiotics. I'm very concerned about antibiotic resistance. I saw a newborn baby this week with MRSA picked up in hospital because we're overusing antibiotics. I have real concern. In this country, people demand antibiotics when they've had a sore throat for 10 minutes. And I don't think a sore throat is actually a simple condition. I saw someone last week, literally last week, I took a swab from a sore throat and she had diphtheria. You cannot just give out antibiotics for sore throat.
Dr Gurlis, we introduced you as a private GP.
Correct.
Do you also work in the NHS?
I see NHS patients who cannot get access to their NHS
OK,
GP.
but
I'm
how much
fully
do they
private.
pay to see you?
Oh, the consultation fee is £120.
Right,
It's expensive.
It's completely free for me to go and see Thorin.
Absolutely.
And the trouble is that the NHS is absolutely overwhelmed, calling at 8 o'clock, as Rishi Sunak calls it, the 8 a.m. scramble, whereas I can walk into my local chemist.
Yeah.
I totally trust my local pharmacist.
That's fine, but this could actually have unintended consequences.
But one of the intended consequences is it could mean that people who do not have the funds to pay to see you and cannot get an appointment with their GP can go round the corner to see Thorin for absolutely no money at all.
It may overload the GPs because at least a third to half of the patients seeing the pharmacist may well be asked to go and see their GP, or they may not recover. In fact, the unintended consequences may be to increase the load on the NHS, because those patients either won't get better or they'll be referred on. It's a bit like NHS 111.
But in that case, wouldn't they get an appointment with the GP?
Not necessarily. It's
says...
just going to increase the workload. There are lots of good ideas in the NHS, from the Nightingale hospitals to Darcy centres to test and trace. A good idea doesn't always work.
Of course.
They often make things worse.
But it just seems if we've got a free alternative which is convenient and local, and patients do trust the person that they're speaking to about their symptoms, why wouldn't you want that to work?
With a sore throat, I'd definitely go to the pharmacist.
Yeah, but you wouldn't go after 10 minutes, which most patients do. And patients come in demanding antibiotics. Most sore throats are caused by viruses.
So, but that completely contradicts your argument, because if patients are every 10 minutes that they've got a sore throat ringing and getting an appointment with their GP, you're relieving the pressure on NHS GPs by
they shouldn't be doing either.
telling them to go to the pharmacist.
They shouldn't either be contacting the GP with a sore throat. They shouldn't be walking into a pharmacy and getting antibiotics for a sore throat.
But I don't... But
we're not going to be giving out antibiotics willy-nilly. We are already... When people come in for antibiotics, I'm already saying to them, you need to make sure you finish the course of antibiotics that you're prescribed, and also you need to know about the consequences of sharing antibiotics. Earlier this year, we heard from the ex-Health and Social Care Secretary about sharing antibiotics, and we warned that you shouldn't be doing that.
That's if you've got unused antibiotic pills at home, and then perhaps another member of the family has a similar condition, and they
absolutely.
And that's completely not recommended.
Not recommended. And then also we're telling people already, antibiotic stewardship, we call it, is a massive programme which pharmacists are involved with. This is part of the system. What we're hearing about, and remember, not all the details have been worked out yet.
No, that's true.
But at the moment, you come into my pharmacy, I've got an item here which I know is what you need. I currently have to send you to a prescriber to get a prescription to come back to me. It doesn't make sense.
And the question is, see, I totally understand this, and I can see why. I'm worried about the complex cases, but in the simple cases, it makes total sense. But what will it actually mean for pharmacists? Are you going to have to start having queues or appointments, or call at 8 in the morning to get to see the pharmacist? Are we going to end up shifting all of those pressures from GPs onto pharmacies, and we'll end up with the same frustrations, but it'll be you who's in the firing line rather than the GPs?
Well, we need investment in the sector, and that's what this is going to bring. I'm not going to say it's going to be enough investment, because we need to think about the funding that's already been cut. Since 2015, we've had a 30% cut in funding. But at the moment, we know that our pharmacy teams want to do this, want to be able to enable professionally.
Can I just say, we know with healthcare, if you try to do anything, it doesn't work. And Parkinson's law applied. The demand will just increase to soak up the available demand, and that's my concern.
Thank goodness we've got the National Health Service to manage the demand then.
Well, the National Health Service, it's not working. Keir Starmer said... The
National Health Service is the most efficient healthcare system in the world.
Keir Starmer said it's broken. Keir Starmer said the NHS is broken. A senior politician has said the NHS is broken.
I think he's quite in favour of the National Health Service.
Don't tell me the NHS is working.
Are you a champion of the National Health Service?
I believe in the principle of it. I absolutely 100% believe in the principle. It's just not working.
Oh, well, I think anyone who tries to get an appointment and has waited for ages would agree that it's not working perfectly, that's for sure.
That is certainly true.
Dr. Gerlis, thank you very much indeed. And Thorin, thank you, Govin, thank you very much indeed.